My name is Carla Cohn. I am a dentist. I've been practicing in Winnipeg since 1991. I've been coming to Western Surgery Centre since that time as well. I have a private practice called Kids Dental, which is my main office that I spend most of my time in, and Western Surgery Centre makes up about a quarter of the time that I spend practicing dentistry. Beyond that, I'm the immediate past president of the Manitoba Dental Association and very involved with the Manitoba Dental Association. I have 3 great children and a lovely husband, and have lived in Winnipeg all my life and did my schooling here as well. And I can say without any question that both my practice at Kids Dental and my practice at Western Surgery Centre have been a fantastic blessing for me. When your child comes to Western Surgery Centre for dental surgery, you should know that we have a great team, a very experienced, caring team that will take care of you and your child from the moment you walk in the door until the moment that you are discharged. It's important for every parent whose child is told to have dental surgery that they do their homework, listen to their dental professional and listen to their advice, make sure that they've covered all of their options, listen to their primary care physician and all of their indications and contraindications that may be there for their child, and then ultimately to come to the surgery center and to ask any other questions that they may have to the anesthetist that has been assigned to that case. Western Surgery Centre, we do all kinds of dental work for children. To simplify the answer would be restorations and extractions. Children who have cavities either need to have those teeth fixed or need to have them removed depending upon the situation. So this is the type of work that we do at Western Surgery Centre. A general anesthetic would be recommended for a child in the case that that child was unable to sit still for dental treatment in a traditional dental setting. That may be because of the age of the child, because of cooperation. That may be because of the extent of work that needs to be done and carried out for that child. So a variety of reasons what a child may be recommended to have dental surgery under general anesthetic. So reasons that a child may not be able to have work done in a traditional office setting would be if a child perhaps has some special needs, they have some cognitive disabilities, again, if the work that needs to be done is extensive and a child's unable to sit still for that type of work. It's a common misconception that baby teeth should not be fixed, as they are just going to fall out. However, we get our first baby tooth at the age of about 6 months, and we don't lose the last tooth until the child is about 12 years of age. So it's a long period of time to have those teeth in your mouth, and those teeth serve a purpose. They allow our children to smile, they allow our children to eat and function, they allow our children to have a space for an adult tooth to grow. So very important for a child to be able to thrive and have a healthy mouth. So baby teeth are important, and they're not just baby teeth, they're kids' teeth. And we wouldn't want to have anything left untreated for any period of time. Infection can happen, pain can happen, and quality of life goes down when you don't have a comfortable, healthy mouth. So complications with baby teeth, infections with baby teeth can affect adult teeth. If the infection is close to the developing tooth under the gums, it can affect the adult tooth. An infection in a baby tooth can travel as well. An infection in an upper tooth can travel up to a child's brain. An infection in a lower tooth can travel down to their airway and cause problems with breathing. So it can become a very serious situation. When we have cavities, we don't think of them as an urgent situation. When they start to hurt, it becomes more of an urgent situation. And then when we have an infection and swelling, then it becomes an emergent situation. We don't want to ever have to have our children go through that type of situation. So we want to take care of things while they are manageable and before infection comes, before pain happens. So at Western Surgery Center, you can be with your child up until the time the child is going into the operating room. Usually a parent will come into the operating room with the child and be there while the child is going off to sleep under the general anesthesia. As soon as the child is asleep, the parent is then asked to leave the room and then brought back to the child when the procedure is completed and the child is in the recovery room and awake again. So as far as the child will know, parent will be with you all of that time. Under a general anesthetic, people do not have any feeling. They will not feel any sensation going through the procedure, so children will not feel or be aware of anything while they're under a general anesthetic. So at Western Surgery Center, we have several dentists that come in and treat their patients. So we as dentists have our private practices where we will see a patient for consultation. If it is deemed appropriate that that child is to come to Western Surgery Center, then the arrangements are made. Once a child comes to Western Surgery Center, they're admitted by our team at our front desk area and then brought into a preoperative assessment room, where they again meet with the dentist, and the anesthetist and the nursing team comes in to see the child and to assess their health. At that point, they are then brought into the operating room. The procedure is done, and from there, the child goes into the recovery room where the parent can be reunited with the child again. You stay in the recovery room until the child is well enough to leave the facility, and then that is the end of your journey at Western Surgery Center. So when you're at Western Surgery Center, you are greeted by the staff at the front desk, and they take a history and physical report from the parent, and then they are brought into the preoperative room where they are again greeted by nursing staff and anesthesia staff and then your dental practitioner. And then in the operating room, of course, you're treated by your dentist and the anesthetist, and again a team of nurses as well as a dental assistant. And then in the recovery room, you're greeted with your recovery room nurse, and you are with that recovery room nurse until your departure from the surgery center. At home, to prepare your child for your procedure, the child needs to know that they're going to get their teeth fixed. Beyond that, leave it to the professionals at Western Surgery Center to prep your child and you and take care of you while you're at Western Surgery Center.